Hello everyone, this is Jeffrey Munson with Dr. Bill Clearfield at the Clearfield Medical Group. So a lot has been going on at the medical group, and today what are we talking about today?
We're going to talk about the missing link in traumatic brain injury. This is a little bit more serious than our usual talks.
Yeah.
But I come across a fabulous, fantastic case that illustrates all the things that we've talked about in the world of hormones. It sort of brings everything together.
Okay.
And so I really want to focus on this gal who came to see me. She's 43 years old. She was a lineman, like a construction, on a street lineman. Mm-hmm. And she was went to the ladies' room, or one of those out in the field kind of things, and it kind of fell over while she was in it. I mean, it sounds funny, but she hit her head.
Oh.
And like the old saying that, I don't remember the old cartoons, or it might have been, I don't know, Beverly Hillbillies. The boy got kicked in the head and he ain't been right since.
Okay.
So,
all right.
So
she fell. So she's in a latrine. And
it fell over, and she
geez.
kind of jarred her head. She just didn't hit it very hard.
Right.
But she was a little bit dizzy for maybe 15, 20 minutes, half hour, and she felt a little nauseous. Her coworkers got her out of there, and it was made a little messy, but got cleaned up, that's.
So she wasn't diagnosed with
she wasn't,
like a concussion or anything like that.
Well, not right. She didn't go right away. Okay. The next day she wasn't feeling quite so well, so her boss sent her to there's workers' compensation.
Oh, right.
All that.
Right.
So the boss sent her to an urgent care.
Okay.
And they checked her out, and they didn't really find a whole lot. She had a headache. They called it a concussion, which is she hit her head, her head hurts, no real trauma. I think they sent her for a CAT scan. They didn't find anything. Everything worked, and they told her to go home and take some aspirin or Advil or something, and she'd be fine. Okay?
Mm-hmm.
So this was over 3 years ago.
Okay.
She hasn't worked since.
Holy jeez.
Yeah. Okay? And she hasn't been right since.
Okay.
And everything, we say, well, she's malingering, she's milking the system, she's doing, that kind of thing, right? But she had always been a hard worker, and she says no. She says she couldn't remember things. Huh. She was turning she went to work the next day, and she was turning the flag the wrong way. She said her left side and right side were all
really
mixed up. Yeah. She thought she was turning left, and she went right.
Wow.
Yeah. Mm-hmm. So, believe it or not, we can actually pinpoint the area of the brain where the injury was, and that would be kind of the parietal area, the side back. Okay. And but we didn't know that till much later. She came to me just a short period ago. In fact, and we're going to talk about what we found, and she doesn't know it yet. We haven't gone over it with her yet.
Okay.
She's out of town, but this was such a classic of what I've been doing the last month or two is I've been doing a lot of lecturing. I was in Florida twice. I was at the A4M, American Academy of American Academy of Anti-Aging Medicine.
Okay.
Medical Acupuncture was the same weekend, but I missed that one.
Okay.
I actually presented the information, and I had used another case, but it wasn't quite as dramatic as this.
Okay.
And so the missing link, we talked about, what is the missing link? So when somebody hits their head, there's two phases. There's the immediate phase, the trauma, and we have to, if there's bleeding, if there's blood clots, if there's a skull fracture, then we have to take care of that.
Right.
But what we're looking at is kind of the long-term effects. Okay. And we really see this in the military guys who've gotten hurt in Afghanistan and Iraq, and the big thing is like the IED injuries, the blast injuries, where they don't get hit by anything. It's like air.
Oh, gotcha.
And they have all sorts of mental and physical problems afterwards, and they didn't get hit by anything.
But
and,
the blast.
But it was it was an air blast, and so it shakes up the inside of the brain.
Yeah.
And what's not been looked at is the hormonal changes that occur not immediately, but 3 months down the road, a year down the road. We've actually documented up to 17 years later from the injury. But 3 months after a traumatic brain injury, and it doesn't have to be, you hit your head going outside the door. It doesn't have to be you lost consciousness and, you were.
Well, we also talked about the, even off-roading, wearing a helmet.
Wearing a helmet, moguls, skiers who go with moguls, bouncing their head, all
And you
of
think
those
because they're
things.
wearing a helmet, and even if they don't fall, you could, the jarring of the moguls
right.
or just off-roading and jumping, and that could cause trauma.
And so this is really a missing link that very few until recently have been looking at. Okay? I mean, the traditional is, once we get you stable and, your blood pressure stable and your brain, even if you had a brain injury or a contusion is stable, is and we start seeing behavioral issues, alcoholism, drug abuse. The two hallmarks, one is the depression, which is 50 to 77% of people who've had head injuries within 3 months have a major depression. I mean, that's a pretty high percent.
Yeah.
And 100% of them have this overwhelming, profound fatigue. And a lot
Really?
of, it's like, it doesn't matter how long you sleep, 12 hours, 14 hours,
Wow.
16 hours. And they have this overall profound fatigue.
Okay.
And traditionally it's looked at as either an anxiety or a depression, and we load them up with anxiety and depression, medications.
That's in the past.
And
That's the past. I mean, that's current.
that's
Doctors are
current.
doing
That's
that,
kind of that's what we do. And it doesn't take care of what the issue is. Okay? And so what we found is that within 3 months of it, even a mild head injury, 56% of those people have some sort of psychiatric, psychologic, or physical trauma that was not present before the injury.
Okay.
If you leave it alone, don't do anything, a year later, more than a third still have it. And that's a lot of people. There were 1.75 million head injuries in the United States in 2016.
Wow.
52,000 deaths.
Really?
1.5 million ER visits. Yeah. Oh yeah.
When you say deaths, I mean, is
The
there
patients die.
I mean, they die because of the injury,
because of
or
the
because
head
of,
injury,
of the depression, or
No,
whatever?
from all related to the head injury.
Oh wow.
I mean, it's a major problem, and 5% of the entire U.S. military has suffered some sort of traumatic brain injury at
sure.
some point in their career. And so, there's how many? Is our cameraman Joel here, our veteran, about 4 million active U.S. I think there's 2 million now.
Yeah.
Okay, so 5% of that is what, 400,000
Yeah.
traumatic brain
lot.
injuries. That's a lot of brain injuries.
And it's
If you-
underreported.
And that's the ones reported.
Underreported,
right?
yeah,
Right?
exactly. Well, people don't know, because I banged my head. I used to run a motorcycle. I had a crash. I didn't
Right.
think to go to a doctor.
So 70% of the head injuries are considered mild.
Okay.
And then half of what's left, about 15% are considered moderate, and 15% are considered severe. So the severe ones you are obvious. The moderate ones are ones that are you sort of like slow reacting. You have you lose consciousness for more than a day, and you don't remember the incident for anywhere from 1 to 7 days.
Now it's moderate.
That's moderate.
Oh, jeez.
Severe is you're basically severe brain trauma and loss of consciousness for greater than a week,
Okay.
and you don't remember the incident a month later.
Well, that was college.
Yeah. Well, I don't think Heineken counts. Well, if you think about it.
So okay, so
This
she had gone to other
lady,
doctors?
this was, she went to, did the traditional route. She went to family doctor, she went to the neurologist, I think she even went to see a neurosurgeon. They sent her to a psychiatrist. She was severely depressed. She had a lot of anxiety. I think there was a suicide attempt in there. She said she had money in her pocket. She don't even know. She went into a store and stole a sweater and got caught.
Oh wow.
Okay, so
Probably not even where she's doing.
well, it was like she didn't have the wherewithal. Well, that's again that part of the brain where the injury is you lose your sense of right and wrong.
Oh wow.
Yeah. okay?
Okay.
Different areas of the brain, like the back of the brain, I mean, you won't be able to speak properly or see properly. We had another gal, 17-year-old gal with a volleyball injury. She got hit square in the head with a volleyball.
Really?
And, yeah, she was dazed for a little bit, and then a couple of weeks later, she couldn't focus reading, and her whole ocular system, her whole eye system was sort of.
So she comes in, or anyone else comes in like that, what do you do? What's different?
So you know, the traditional way to handle it is, you know, first again, take care of the immediate, you know, any type of brain injury, you know, you have skull fractures, any blood clots, bleeding in the brain, you have to stabilize those.
Okay.
And then traditionally, if they're okay, you send them home. If they're not okay, there's a lot of rehab units all across the country, and you know, we try and rehabilitate them. Okay. We have psychologists and care workers, and you know, the traditional avenue is an antidepressant.
Oh, okay.
Okay, and it's called, and then there's talking therapy.
But
okay.
This is not what you do.
No, this is not what we.
That's why I want to be sure they understand that. That's
I'm just giving you
kind of what happens
you know,
in general. If you go, if
right.
they were to go to their
Right.
GP and
Right.
they got referred to another doctor, that's the process.
Yeah, you have to remember, this is not what we're doing here. You know, we're kind of like a specialty, and the folks we see have been through the mill.
Okay.
Okay, so their blood pressures are stabilized, their sugars are stabilized. If they had any kinds of traumas, they've been repaired, and now we're left with somebody who is just kind of there.
Okay.
Okay, so this lady, who was, you know, a fully employed mother of three, I think, mother of three, you know, was on the PTA and went to the school plays and this, basically sitting at home doing nothing for 3 full years.
Wow. Wow.
Okay, and they throw up their hands and they say, I don't know what we can do, nothing we can do about it. Okay, so as you know, we're the hormone guys,
Right.
And the hormones, where they originate is in the center of the brain.
Okay.
Okay, there are 2 structures. It's called the whole thing's called the limbic system.
Okay.
And they control your emotions, your moods, how you interact with the rest of the world. If you take a string and put it from the bottom of your chin to the top of your head, run it straight through there, and then go from ear to ear, where they would meet in the center of your brain, there are 2 structures.
Okay.
One's called the pituitary,
Yes.
and one's called the hypothalamus.
Okay.
Okay? And those are the structures that generate the signals, the precursors to all of the hormones in the body, or a good many of them, the major ones.
Okay.
And they are very delicate structures. They're very tiny, and the pituitary gland has a very delicate vascular system,
Okay.
and the hypothalamus is actually on a tiny stalk and has very fine blood vessels and nerve endings.
Okay.
And all of your hormones are generated in that area.
Okay.
Okay? So it wasn't until the mid to late 80s that anyone actually even looked at the hormones, and it's certainly not routine even now.
Oh, really? Okay.
Yeah. Okay? And you would think that with behavioral issues, suicide issues, you know, an inability to tell right from wrong, left from right, you know, all of those things, massive weight gain in 3 weeks, you know, is common. Severe depression, severe fatigue, severe anxiety, and all of the traditional approaches don't seem to work. In fact, they make things worse.
Okay.
They don't correct the hormonal imbalance.
So why do you think that that's like most doctors their approaches, they don't think about the hormones? Why do you think?
You know, hormones are scary, and if you
okay.
you really, it's a real specialty. You really need to study them. It's not, you know, you get a blood test, and we have the, you know, those wide ranges. So when you get a blood test, and I'll use vitamin D as an example because it's easy numbers. You'll get it'll say, most labs will say 30 to 100 is normal.
Okay.
So 32 is normal, and 92 is normal.
Okay.
You think there's a difference between them?
Yeah.
Yeah, there is. So those ranges are 2 standard deviations, a statistical model of whatever you're measuring. 2 standard deviations is 95.4% of whatever you're measuring.
Okay.
Okay? So if you take all the things, all the instruments that we have in this room, 95.4% of them will be in every other doctor's, treatment room.
Sure.
Of a similar ilk,
Mhm.
okay? If we, we're on a busy street corner here in Reno, Nevada. If we stop everybody who stops at the light on a street corner and draw their vitamin D levels,
Okay.
25 hydroxyvitamin D to be exact, 95.4% of them will be between 30 and 100,
Okay.
okay? An 18-year-old, a 90-year-old. And it's not corrected for anything.
Hmm.
So we need to narrow that down.
Oh,
That's
okay.
too wide a range.
Oh,
It just
sure.
doesn't work. I mean,
Sure,
if we want to be, I'll give you a good example. So do we want to be, you remember who, Ralph Cramden?
Yes.
The Honeymooners, Fred Flintstone?
Yes.
Right? You want to be Ralph Cramden? Or do you want to be Tony the Tiger?
Tony the Tiger.
Yeah, you want to be Tony
Oh,
the
yeah.
Tiger, okay? And and as we mature, as you know,
My
you're on the
gray
sunny
hair.
side.
Yeah.
It's silver,
Silver.
right?
Yes.
See, it's not gray,
Yes.
it's silver.
So,
Okay, as we mature, it gets harder and harder to keep
Right.
keep ourselves well.
Right,
It
right.
takes more time. Things don't snap back as much. You're a dancer. You all of a sudden you're getting hip pain and foot pain that
Mhm.
would go away in half an hour. Now is hanging around for 2 weeks.
Right.
I'm sure some of my favorite old baseball players still know how to hit a baseball, but
Mhm.
they just can't quite get around
Right.
on the ball. So.
Right.
So, we have spent a lot of time studying chronic diseases, and we found a very useful tool in getting all of our patients' hormones, the major ones. There's 36 hormones in the body, but the major ones, anywhere from five to nine big ones,
Mhm.
in balance, goes a long way to improving strength, energy, a sense of well-being, behavioral issues. For example, we see a lot of young ladies, and in the hormone world, young is 35 to 50,
Mhm.
who come to see me and they've had depressions, anxieties. We're not talking about head injuries at the moment, and they're on Zoloft and Xanax and Prozac and Klonopin, antidepressants,
Okay.
right?
Mhm.
And if we measure their hormone levels, and usually I can actually tell by just asking them a few questions, progesterone is the first hormone that starts to go away when
Okay.
you start going through menopause.
Ah.
And the symptoms are agitation, irritability, you feel like you snap at others, especially your those closest to you, headaches, poor libido, you feel like they feel like they're going to jump out of their skin.
Mhm.
So you can ask your dance clients if you so inclined, if they're acting a little
Sure,
agitated,
absolutely.
right?
So,
Right? And Xanax and Zoloft and all those things will work for a little while, but that doesn't get to the problem.
Right.
The issue is low progesterone. That's the first hormone that goes away.
Okay.
I said falls. 4 weeks of progesterone, boom,
Okay.
no more need for
Okay,
Zoloft. So in our head injury,
Uh-huh.
so the major times of head injuries statistically, ages 0 to 4. The really critical ones are the preteens, 9 to 13.
Okay.
You know why?
No.
Well,
Oh, the hormones are
that's when the
raising.
hormones
Yeah,
are
yeah, exactly.
beginning to form. So
So-
you have a head injury when right? I mean, you're setting yourself up for
Mhm.
major complications for a long time, if not a
Okay.
lifetime.
So,
Okay.
so a child can have
Child,
this.
a child can have it.
Okay.
And in older adults, anybody over 75.
Okay.
Those are the ones who kind of.
So-
succumb. So this gal came to me. I have a little TV commercial on
Okay.
a local station,
Okay.
and she responded, and she came in, and she told me her story, and she was classic. She had them all. She had depression, anxiety.
Mm.
She didn't feel like doing anything. She had the shoplifting episode. She had a suicide attempt, and I think she said she didn't really want to do it, but it was kind of for whatever reason.
Right.
Okay, and so and then I went through all of the different hormone cascades, and yet she had some yes, some no, some maybe. So then we did the measurements, and we did our laboratory studies, and 4 of the 5 major hormones are all abnormal,
Ah, there we go.
right?
Mm-hmm.
And I mean, this is just the classic in the textbook of the traumatic brain injury hormone world. And I'm I'm really excited about this because we can really make a difference in her.
Okay.
In her.
So we're gonna
go. I'm gonna
document this.
Yeah, I have it all documented.
Okay.
I mean, I have her lab studies here.
I mean, what we want to do is kind of follow this case.
Yeah, we're gonna follow this case.
So today's was
just kind of an introduction.
Yeah, today's a little introduction of because people you don't think about.
Mm-hmm.
I can see why. I mean, not being a medical doctor, if I'm just
You're
like
not.
I know. I mean, if I wasn't, I played one on TV once, but
You played them on the YouTube videos.
but I can see that people like, well, you're just depressed.
Right. Mm-hmm.
What's wrong with you? All your friends and family, what's wrong with you?
And take some more.
Yeah.
Right. And so the traditional approach is we're going to give you an antidepressant.
I actually, it's interesting because I have a friend that has a child that is a skier that does a lot of tricks and does a lot of, and I'm sure it's crashed on his head, and he's different. And I'm like, I'm going to talk to her and go, maybe you should have this checked with your son, because he does all the flips and all the jarring and all the slamming his head into the ground.
Mm-hmm. Yeah.
I never thought about that.
Yeah. And especially like I said, the age 9 to 13. I mean, that's a really vulnerable age because it's right. It's right as your hormonal systems are forming.
Yeah.
Right.
Okay.
So.
All right. So our patient.
Is 43 years old.
Okay.
She's been pretty much since she had this injury. And everybody says, well, the thing fell over. Everybody laughs, right? But it's ruined her life.
Right.
She's gained 62 pounds.
Oh,
right. She has high blood pressure. Her husband has left and had a
well,
outside.
We don't need to go
yeah,
into that. But it's her trauma of the head injury has caused trauma in her life.
In her life.
And so hopefully when you've got all the labs back.
I have all the labs.
You got all the labs back, and so when you go over with it, you'll customize a treatment for her.
Absolutely.
Okay, and then we'll do a progressive report to see how she's doing.
Correct.
And like when we did an interview with Joel, our camera guy, right? And you had similar. This is kind of how you all met, right? How you've changed dramatically. I'm like, I can't believe what you told me that you were like before. It's amazing.
He didn't grow a beard for 20 years.
Yeah, he's got a full beard.
We got to put him on camera now. Now you need a trim.
So anyways, so we're gonna kind of end it here. So and what we'll do is we'll do a follow up. So any of you that are watching have questions, please comment down below if you have questions about this, or if you have you notice that either your child or your spouse or your friends
or
yourself, you're realizing you have depression. You have think back. Now, okay, so this is a quick question, just for them. Let's say, I don't think I ever hit my head.
Well, I get that a lot. In fact, that's part of I ask everybody now, did you ever have a head injury? Everybody who comes in here the first time.
I don't know.
And a lot of times I'll get, well, I don't know, or I don't think so, or I don't know, or I could have, or.
So you should still have your labs checked anyways.
Well, this is our specialty, so we do this.
Okay,
but my point is that if you go to your GP,
right,
you should insist on having this looked at. If you've had some sort of head trauma, some sort of bizarre behaviors, and what we're finding is schizophrenia.
Oh, really?
All sorts of severe mental issues.
So,
PTSD.
Yeah, PTSD.
Mm-hmm.
There are profound hormonal changes that occur in a great many of these patients.
And like you said, the military.
Yeah, the military
guys who didn't get hit, but they had it from what was it, the blast of IED blast. So it could be anything. So if someone was, I'm just throwing this out there. If someone was like, God, I feel like I've got depression. I'm told I have depression. I'm told I have anxieties, all this stuff. Should they just get their hormones checked anyways?
I would check them, sure.
So guys, I mean, there are a lot of you out there with that concept.
Yeah. Mm-hmm.
Just get your hormones checked. I would go to an expert in what they're doing instead of a GP, probably, so they know what they're doing.
Yeah, you don't want to look at say you're
you're
in the range.
Yeah.
2 to 400 is normal.
Yeah.
You're at 6, you're normal. Go home.
Okay.
You don't want that.
All right.
That's kind of.
So I'm looking forward to the follow up for this, and it'll be it takes time.
It does take time. Now, my mentors, the people that I learned from long ago, they used to say it would take 6 months to 2 years to straighten things out.
Okay.
And quite frankly, with traumatic brain injuries, especially a long-standing one, that's probably correct.
Okay.
We try to shorten it down.
Okay.
So we try at least to have some sort of progress within
Yeah.
3 to 6 months. So even that is, it's not tomorrow. And a lot of these people, a lot of these folks are, they're anxious. They've been sick for a long time, and nothing seems to improve. Okay.
Right.
But we get a lot of them off of those medications. Just getting them off of those. Some of them are on. Joe, how many medications were you on?
I was on 13.
You were on 13 medications
a
at one time.
Before he
Per
met
day.
you?
Yeah.
You're kidding me.
Yeah.
Wow.
How many are you on now?
And Estrozole, 2 a week. That's it.
Wow.
And that's the estrogen blocker,
Yeah.
Ah, okay.
because his testosterone is working so well
Oh,
that
that's
it's
great.
driving his estrogen.
Aha, there we go.
Right?
Man boobs?
Huh?
That's stuff to man boobs.
It's not that
All right, so we got to get going. This has really been long but very informational, and there's a lot. It's so important that people don't think about it. And
And so I hope in future videos we'll go over, we'll follow her progress. We'll give you, I'll talk about my thinking on how we process it.
Okay.
We'll follow her progress. It's not straight up. Hopefully it's like a stock market. It kind of goes like this. We do have ups and downs. We'll talk about some nutritional issues. We'll talk about exercise. It's kind of a whole lifestyle.
okay.
Kind of thing.
Okay. All right. So everyone, if you have any of the symptoms, or if you know anyone who does, it'd be a good idea to either contact your doctor or call Dr. Bill here at the Clearfield Medical Group.
775-359-1222.
Yeah, all the information will be below. But I being just the sidebar here is what to me, Dr. Bill called me and said, hey, we need to put this on film. We need to talk about this because there's so many things out there. The passion that you have for this.
This is our thing. So
Absolutely.
like I said, I've spent,
you do aesthetics. You do
Yeah,
all this
we have a
lifts,
lot- we have a lot-
non-surgical lifts. You do
we
all
have,
these things.
we have do
but
lots
this
of
is
fun stuff.
But this is a passion that you
But this is-
have, and
this is-
you've helped a
I
lot of
have to
people.
contribute something to this.
Absolutely. So, so this is the man that I would talk to about anything. So, anyways, not only are you my friend, you are my doctor, and I trust him completely. And everyone, I would.
And you are my dance teacher.
I would call him for any problems you have. So, anyways, everybody, as always, thank you for watching. Have a wonderful day, and be a good human.